Okay, it's a couple of minutes past 1 o'clock, so I think we'll get started. Oh, hi everybody, welcome to Grand Rounds. My name is Leslie Crichton, and along with Tom, who most people will know, I'm one of the organisers of the Grand Rounds meetings. So welcome, and I hope everyone's feeling a bit more positive now with the onset of spring. Today I am delighted to introduce Dr. Andrea Rodriguez and Professor Neiva Vieira, who are going to talk to us about their project, helping young people to feel at home. So I'll tell you a little bit about them. Dr. Rodriguez is a lecturer in social psychology and community health at the School of Dentistry here in Dundee. She has an MA in psychosociology of communities and a PhD in social psychology from Federal University of Rio de Janeiro in Brazil. She's academic and professional experience working for over 15 years in the third sector and government agencies in Brazil with vulnerable and stigmatized groups. And she currently leads the Smile for Life research project to promote oral health and psychosocial well-being for people experiencing homelessness in Scotland, with research links in Brazil and a research focus on youth homelessness. And Professor Vieira works at the School of Nursing at Federal University of Ceará in Brazil, although having said that, at the moment she's in Bristol visiting family. And that's within the nursing postgraduate programme and the professional master programme in family health. She's a PhD in health education from the University of Bristol in the UK, and she's a CNPQ researcher. I don't know what that stands for, maybe she'll elaborate. And her area of study is health education and adolescent health promotion. So I'm going to let them continue. If anyone has any questions, please note them in the comments bar, or if you want to ask a question, let me know in the comments, the chat bar, and I'll draw attention to you at the end. So go ahead, Andrea and Neiva.
Okay, thank you, Leslie, for the invitation to be here. It's a pleasure. So today we're going to present an experience of using art approaches and community-based participatory research to promote health equity of vulnerable and marginalized groups in Scotland and Brazil. So we are going to describe it briefly because we're going to watch a video and then we're going to have more time to make questions and comments about the video. But just to start the conversation, I just want to explain that we did together, Brazil and Scotland, we did a knowledge exchange program on youth homelessness. This program wanted to discuss issues regarding service provision for young people experiencing homelessness and professional approaches, practitioner approaches towards these groups. This program was in 2019. We developed in Scotland and Brazil. We listened 66 young people from both countries on this issue. So the element of involving young people with lived experience in this program was central. We wanted to listen from their experience, their views, their feelings about how it's difficult to engage with services, how it's difficult to access services, and what kind of service they would like to receive. In this type of research, as I said, participatory research in this type of research it's central that we find ways to reach and to talk with people living the problems that we wanted to address. And to do this, we found art, the element of art, as a very good tool to engage with these groups and to making them feel comfortable to express their views, their feelings in their own terms. So this knowledge exchange program, we produced recommendations in a final report that I'm going to put the link in the chat in a few minutes for those who want to access, but we produced recommendations on how to prevent youth homelessness, how to address, to improve service provision, and how to improve professional practice based on their views of young people and practitioners working with them. we produced a documentary, a video, practitioner video training that we are going to watch today. It's a 20 minutes video training to address students and practitioners working in this field, of having interest to work in this field. In this video, we will see how the element of art was used through the whole program to mobilize this audience and to co-produce knowledge with them about their lives. So we used graffiti, we used music, we used theater. Theater of the oppressed is a technique that came from Brazil, that was developed in Brazil to help communities to discuss sensitive issues, to help voiceless groups in society to express themselves. And the element of social justice and equity, it's central and based these discussions. So yeah, the video will show this, and the collaboration with Brazil was very important because we want to think about the issues in society together with different countries, with different contexts. So the problem of youth homelessness in Scotland and Brazil, they are different. They are different somehow. The poverty here is different than the poverty there. The social inequalities are different. The language, culture, we have certain difference between the countries, but working together, we discover that we have more similarities that we imagine, and we were together committed to produce joint effort to tackle youth homelessness, to produce materials, training materials, to help practitioners to discuss this issue independent of the country. So this was the idea of the collaboration, to joint effort, to do better what we do, but doing together. So this is what I have to say. Now, Professor Neiva will speak a bit as well about our work together, and then we are going to watch the video.
Okay, thank you very much once again to Dr. Andrea Rodrigues to invite me to be here, and Dr. Leslie also for the opportunity to share the experience and promote health to youth homeless between our countries. I speak from the experience we developed in Fortaleza, the capital city of Ceará, state in the northeast part of Brazil. I'm a public health nurse. It was a great learning experience to participate in the Youth Homeless Project, map the aspect of oral health and social, psychosocial needs of homeless youth in Brazil. Although we live in different countries, we keep some similarity, especially of the reasons of the adolescent and youth leave their country. Most of them leave their country due to their links with their family are very fragile, and because of the drug, sometimes because of the drug use among in the family context, and this provoke him to leave and to go to the streets. Also, we have extreme poverty. Although my city is one of the big cities of the country, like the fifth city of the country, we have extreme inequality, social inequality. The strategy used during that experience have enforced our belief as a health professionals, highlight the need to enlarge our understanding of care for people in vulnerable conditions. To provide them with health care, cross the boundaries beyond biological criteria is necessary. But we recognize this is not an easy path, because not only it needs an intersectoral collaboration and approach, but their voice and needs must be heard and included. After the experience with the Youth Homeless Project, we moved to Fortaleza to mobilize the social and health service to discuss the assistance of youth homeless. We founded in Fortaleza contest many services, sometimes doing similar things, sometimes approach the same area, but they don't talk to each other. They don't exchange service. We planned and developed together a workshop with people from the social and health service, such as social educators, social workers, stakeholders, to identify common key issues to work and to benefit homeless youth. At that workshop, the health professionals and the social service who were participated, they acknowledged that their work was not seen as available by other health professionals, and that a network of care and its continuity needs to be established and reinforced among other health and social services. Also, another important point is that this conversation needs to be started early in the undergraduate education of these professionals. Because as a health professionals, we are learn and we have learning experience to care people in a context of primary health care unit or in a hospital. But we don't have skills, developed skills in the university context to how to approach people in a vulnerable situation, like homeless or indigenous people or people from minority groups. The challenges still remain. We participate in a training education program for youth counselor and the social educators. This was another opportunity we had after the project start and my participation in the project. This training valued their voice and experience in the field. And also we debated and shared the possible ways to trace the path to improve the quality of assistance of homeless youth. We have engaged with nurse postgraduate students to conduct research to improve the healthcare of homeless youth under a wide health comprehension. These include holiness of care, intersectoral collaboration, and social support. Currently, as a result of this experience, this has led us to expand the health promotion in adolescents and youths and vulnerable areas of the city, utilizing the existing social service available. The social equipment available in the city, they were settled in a very vulnerable area of the city. These adolescents and youth who attend to this social equipment, they are not homeless, but they are in danger to be a homeless. This hopes, the project we are engaged in now, this hopes to prevent them into fall into greater vulnerability, such as drug abuse, sex exploitation, and joint gang factions. This is the move that we currently start with in a project developing. We are in a very beginning. We are doing some context of people who coordinate this social equipment for youth and adolescent youth in vulnerable areas. We started just in the beginning to develop a big project. And this social equipment, they have arts, sports, and training courses for getting jobs. So we are very hopeful that can increase and we can do with this experience we had, a better life for them. Thank you.
Okay, ready for the video now?
This is a problem that we all must to address. Society as a whole, university, policymakers, services and professionals from different sectors, we all need to talk about this. We need to discuss joint strategies to improve services, to improve practices, and to improve our capacity to work together.
In Scotland, almost 25% of all applications are made from young people, and that is really an alarming figure, and it shows that we quite clearly need a joint approach to tackle homelessness and all the issues behind it. So I think that's exactly what A Way Home wants to achieve, and that's what this event promotes and highlights. So that's the connection between the two.
With this knowledge exchange program, we wanted to create not just a safe space with a good atmosphere and the element of joy and art, where young people and practitioners could feel comfortable to share their views. Actually, we wanted to start a process of engagement, an opportunity for people to interact with each other and share challenges, achievements, new ideas, building trust relationships in this process, which I think is essential if you want to find joint solutions. We need to spend time together. The program was divided in 3 main events and 7 youth consultations. The structure of the events involved national and international key speakers, bringing their knowledge, their practices, and their research on youth homelessness. We also had group discussions, interactive sessions when participants could reflect about young people's trajectories through different services and through different stages of homelessness, to identify and to discuss gaps in terms of service provision for young people through different and creative methods. We had key services working with young people in 2 cities in Scotland, attending the events and contributing with this program and helping us to design and shape the proposal and also to deliver the workshop events.
A Way Home wants to end youth homelessness. We work with partners across all sectors to ensure that we can align our strategies and resources to ensure that young people can move away from homelessness or that they can receive the support they need when they're in a crisis.
What we offer to young people is sort of easy access support for a whole range of issues. We deal with everything from mental health to sexual health. So what we offer is a drop-in which is open 6 days a week. There's no appointment, young people can just turn up, which is great in terms of providing a service that young people can access without any concerns about appointments or being late. When young people come in, we aren't a specific homelessness service, but we do have really strong partnerships with other services in the city. So we will make referrals or make phone calls for young people to make sure that they're seen by the right service.
We have a youth options service, which is a service that meets people at time of crisis, young people aged 16 to 21. We also have the youth housing service, which if young people do require temporary accommodation, they can access that via ourselves. But we also have a family service, a family sustainment service, substance misuse service, and a service who works with offending behaviour, including domestic abuse actually. It's quite a range of services that also underpin that.
Hot Chocolate is a youth work organisation in Dundee. We work with young people for whom the city centre has become their congregating point. So they live all over the city in different communities. A kind of subculture within the city centre has become the place that they belong. We build community with young people and collaborate with them to make a difference in their lives. So we're responding to young people's needs, but also their ambitions, and working alongside them to realise these ambitions or to meet these needs.
The Scottish Youth Parliament is the democratically elected voice of Scotland's young people. It exists to represent the views of young people and take them on a national platform and onto decision makers. So I think in the context of youth homelessness, it's really important that we get the views of young people at the forefront of any legislative discussion about youth homelessness. I want the Scottish Youth Parliament to not only help take the cause of youth homelessness out to the public, put it on social media, get it to the forefront of Scottish politics, but I think even more importantly, make sure that when we take it to Parliament, that young people's voices are at the forefront of it.
The theatre of the oppressed is an umbrella term, a name given to a set of techniques and a kind of theatrical philosophy developed by a theatre director called Augusto Boal, who was a Brazilian. And it's really a way of using theatre, of anybody being able to use theatre to have a dialogue over particular issues. But it's particularly interested in looking at where injustice is, where oppression is, and using theatre to both highlight this and as a way of finding ways to overcome this as well.
Music was another element present during the workshop event to make a relaxed atmosphere. We had 2 different bands playing during lunchtime, and this was something very well received by the participants. I believe when we work with complex and difficult scenarios, I think we tend to focus on what still should be done, the gaps, the problems, and we forget to celebrate small achievements. We forget to enjoy each other's company and to be happy with the commitment that in fact brought all of us together in this program. And I think the music is a kind of brilliant element to make us to be more connected. Capoeira was developed by African slaves in Brazil in the colonial period as a way to fight against oppression, and uses music, dance and singing. And it is related with this program as capoeira was a movement of resistance, a collective fight for freedom and social justice. It would be something that we all share as a goal, independent of our area of expertise. We all want social changes that improve people's lives. The use of graffiti was another innovative way to close the program. We wanted to translate the key recommendations coming from this program into a graffiti panel. This graffiti panel will be placed in a youth services in Dundee as a kind of symbol of our commitment to make services more open, to incorporate all the young people's needs and aspirations. Between the main events, we had small consultations with young people, and this was essential for us in terms of methodology to engage with them, because acted like a preparation for those attending the events, but also a way to reach those young people that could not attend the events. Academic environments can be quite intimidating sometimes, and a young person may not feel comfortable or ready for occupying certain spaces and raise their voices. And we need to respect this, but also we need to create other ways to get their participations, to engage with them.
Today's been great. It's been a really good opportunity to meet with lots of different people from the third sector and some people from the public sector as well. Everybody has this common goal to tackle youth homelessness, which is such a really nice environment. Everybody's got this sort of shared drive, and so it was good to be in among that and be able to experience that. My favourite part of the day was probably when we broke off into our smaller groups, because it allowed a bit more in-depth discussion with people about their role. So today I was paired up with someone from LGBT Youth Scotland, someone who was involved with care experience young people, and someone who was involved in North Lanarkshire housing. So it was just this great blend of people who all wanted the best for young people, and we were talking about different strategies, different experiences, and it was just a really positive experience to talk about all of our different perspectives on the same issue.
Today was brilliant actually, really good. I liked the mix of the activities and the sort of discussions that we had and the speakers with some of the workshops that we did. Having the capoeira people in was amazing, so was the drama stuff. I really love that type of activities. So yeah, I think it's really good to have things that you can feel engaged in and energised by, as well as being able to express and vent and get all that sort of viewpoints out as well. So yeah, it was a really good mix.
Because in Brazil as well, we use so much arts and creative work, and so you can use as well some experience here. We can compare, we can see how the experience will fit on Brazil and how our experience can fit here as well in Scotland. I think we can both benefit that experience.
The crucial thing is relationship. I think it's really important that they know that you care. I mean, when they first meet you, they're looking for some sort of empathy. They don't want to see a form forced in their face about their date of birth, age, etc. They want to know how you could help them. So I think that's the most important.
But I think the biggest problem in services is the fact that there's so much break in that continuity of care, and we're expecting, or the system expects, individuals to jump those breaks in order to stay on a programme. And I think that projects such as this, which brings those organisations together, actually bridges those gaps. So we are able to look at how do we provide a seamless progress through a system.
One of the main anxieties that people have about accessing dental treatment when they haven't done for quite a long time is that they'll be out of control of the situation. So they're going to walk into the practice, the door will close behind them and that's it. Things are going to happen to their teeth and they're going to have no control over it.
And sometimes with young offenders and also young people, teenagers, they see me as an oral health professional as being the do-gooder, telling them what to do, but I always go and speak to them, and you know, when they seek me when they've got toothache, and I give them some oral health advice, but it's everything in moderation. So I always say it's your choice.
What they need most is a service that's available to when suits their needs. A lot of services can be 9 to 5, and actually what we find is young people are chaotic and maybe they can't maintain appointments, they can't come to a service during the day. Actually, some people need services in the evening, so it's about making sure that we're there for the young people when they need them most. And that's not always easy in terms of funding or staffing. That can be really difficult, but I think we as practitioners need to be more flexible to young people's needs.
At a point of seeking help, all of us are acutely aware of the kind of cultural indignity of failure, of needing somebody's help. And young people are no different. The expectation of British society is that you should be thriving and working and secure, and so at these moments there's a sense of shame as well as the practicalities of what young people are going through. So the times when young people engage with somebody who exacerbates that sense of shame are overwhelmingly likely to be the ones that they react very badly to, that they don't want to go back, that they want to find other ways of making this work, even when they don't have any other options.
When working with young people, it's important to build trust. And how do you build trust? Well, make sure that young people know that they are heard, that they are cared for, they're respected, and learn from them, have fun with them. Let them take decisions with you and let them make their own mistakes. And more importantly, don't ever give up on them.
I do believe that everything is about relationships. If you can create a relationship with a person and you can show them that you're with them and that you're there for them and you're willing to help, I think that's probably the most important. You don't necessarily have to know the answers. Sometimes young people know the answers themselves. They just need somebody to support them to go through that process.
Always promise what you can deliver, never overstretch. Because it's very difficult, as you know, I used the word trust before, it's very difficult to build up trust, very, very easy to lose it. If you overpromise what you can and can't deliver and then fail in delivering that service or delivering that product, you lose the trust of that client. I think they need to be honest, transparent in everything that they do and listen, because the person who knows best what's right for them is the very person that's sitting in front of you, and they're not sitting somewhere else.
The best strategies to prevent youth homelessness is early intervention. And we do this through, again, sometimes at the time of crisis, which is a bit strange to say that, but often that's the first point that you know that the young person is in effect homeless. We also have a housing education for youth programme, Hey Dundee it's called. It's coordinated by Acts for Children, but it's made up of several partners, and it's about going into schools to educate and let them know that there are services out there if you do become homeless, but actually if it's safe to stay at the family home, that's the best place to be.
We have to build healthy public policies and start to create supportive environments for young people living in our communities. That people who are socially excluded, who are on the edge of society, who experience multidimensional poverty. We've heard today about relational poverty and how that changes over time.
Without fighting stigma, without fighting negative social representations, it's very difficult to change even the way people work with homeless people and the way people even welcome them in institutions. We know that in many cases, homeless people feel not welcome where they go, simply because of stigma. So if you want to change the situation, it's also necessary to change the way services welcome people on the doors.
I think one of the most crucial things when engaging with young people, when working with young people, is being ready to meet them as whole people and enter into a relationship with them. And that doesn't mean that we have to be everybody's friend or we have to deal with everything. We can be focused within that. It's about meeting young people in their need rather than meeting the needs of the young people. If we're only seeing the need, we're stripping away the dignity of the person. By doing so, we're undercutting our own efforts, because all of us, when we feel that we're not being valued, not being seen as whole people, we react against that. And if we're already feeling ashamed, feeling guilty, feeling that we're not coping with things the way that we should, then all the more so. So if we want to have effective services that are engaging with young people and making a difference, we have to start by thinking about how do we get those relationships right? How do we get that moment of engagement right so that we're communicating acceptance, communicating dignity, and we're communicating an expectation that we and that young person can work together as equals to bring about change together.
There's a lot of people wanting to do the best by young people and providing the best service, but I think what needs to happen is more partnerships, stronger partnerships, maybe more integrated services so that there's maybe more people within a team that can provide all of the sort of support that young people need, so it's more holistic, so that young people aren't having to go to one space to another space to another space. If we could bring everything into one space so young people could get everything there, I think that might be an interesting angle to look at.
Young people find useful services that are representative, inclusive, safe. They want services that are flexible, accessible, that are also fun, and especially when they are encouraged to come back and when they are treated like people. And it sounds really obvious, but that is more the exception rather than the rule.
This program wanted to listen the voices of young people about the services they would like to receive at the right time of their journey. As a big lesson that we learn from this process is that engaged service users begin with engaged practitioners. We need to go out where they are and listen to them on their own terms, and learning from this process if you want to implement social change.
Andrea, did you want to lead the next bit?
So I think the video explained very well how was the process, the key topics that we discussed and what we learned from this experience of engagement with young people practitioners. So now we are here just more to have informal talk about the video, the key message, what you would like to ask or comment, any reflection on the video. So now I think the moment is just for us to have a chat. If you have any questions that you'd like to make, the audience, what did you find about the art approach, how it was used during the program? Any question?
I can start. It's such a lovely video to watch. I've seen it a couple of times now, and I'm filled with awe at what you managed to achieve, and also filled with envy, because I can't even imagine being in a room now and listening to music and talking to people and, you know, dancing and doing all these different things. So we did actually in the process of putting in a bid for the same funding stream as the SUIA funding stream as you did. And the challenge for us is trying to exchange knowledge, design knowledge exchange programs that don't involve people being in the same room. And you talked about, the importance of getting people together. And I wondered if you'd found any innovative ways other than Zoom meetings of getting people together in the last year, and how you'd found, what were the sort of successes and challenges of the last year when you couldn't get people into the same room in the same way.
Mm-hmm. Very good point, Leslie. I think for those who work in participatory ways, who develop participatory research, these years has been a challenge for us because the strong interaction with participants is the key for us, is the central element. So with the pandemic scenario, we had to reinvent ourselves, to recreate ways to get in touch with these groups, to keep doing the research with them. So in my case, what helped me a lot, because I'm just going to currently to start another project that will be done online, workshop groups, group activities with young people and adults experiencing homelessness. But this was just possible because I had a previous experience with them. I already had built trust. I already had done, started this process of conversation because it's something that takes time. So I'm in a position that is not so bad for myself because my partners are already engaged with this topic, with the process. So it was just the matter with them to decide the best ways, how we are going to develop new actions, new research using technology. What kind of technology could be possible? Zoom, WhatsApp, Facebook, telephone, mobile phone. So I'm not feeling so well, the pandemic restriction, but for those who will start to do some process of engagement in this scenario, is not something that is not possible. It's possible. I think we do not give up to do this type of research because of the scenario. But we need to have in mind that will take more time to develop this trust, because the trust, to do this program, we had the 3 main events, but between the events, we had to develop several meetings to prepare the young people to be there, as I explained. So it was not, if I had not planned it very well, the timeline for my project, count with this reserve time to build trust, it would not be possible. So my suggestion for researchers who are going to start to do participatory research during pandemic is to reserve enough time, a very big amount of time in the beginning, to start conversations, to make informal talks about your idea, to listen more than to speak, letting them speaking more about the issues that are important to them, to be studied or researched, not our issues. And after we listen their issues, their main problems, then we can combine our interests, our research, but the focus should be what is meaning for them. Otherwise, it's difficult for them to engage with us.
Thank you. Does anyone else have any questions?
I put the video, the link for the video for you to disseminate. And I also will put a small survey for the video. That is very important for us as well, to have your feedback about the video as a tool, as a training tool, to discuss these issues with practitioners. So the link for the small surveys, 3 minutes, 5 minutes maximum to respond, and will help a lot to see what could be improved, because we are just in the moment to start a new project to develop other training materials. So this will be very helpful.
Okay, last call for any questions.
There is another element, Leslie, if someone is thinking about that, that you mentioned as well, and for us initially was a kind of we were afraid that the people would engage with music, different art languages, graffiti, music, capoeira, theater. But we decided to take the risk to propose these activities because we wanted to leave a certain comfort zone that us academics and practitioners, we are more familiar to a certain kind of format, to event, to group discussions. And we thought that we had to expose ourselves as well in front of the young people, using theater to discuss an important issue, using music, using capoeira, because we wanted them to do the same. We were asking them to expose themselves as well. But we are in a comfortable position because the ways that we are asking them to engage with us were through our own terms, academic formats. And it's not always the best format to engage with certain groups. So for us, the element of art was a learning as well, to try to leave comfort zones, try to expose ourselves and try to be creative in these conversations. And I think we reached this aim. The result was very good. In the beginning, people found certain not comfortable, but then when we started, when we could see everybody make an effort and being creative, we could be more linked, united. We develop a trust bond between each participant. The young people felt very comfortable as well to express themselves. So we all gain with this kind of methodology.
Thank you so much. There's a question from Dr. Kevin McConville in the chat. He says, a very positive video, thanks, and a fun methodological approach. The recommendations wouldn't be that different from what adults would like also, but I'm left confused as to where you see future outputs actually being useful or implemented. What were you able to do with the outputs from the project?
We produced a final report, like I said, with key recommendations to improve professional practice and service provision. We made links during the program with policymakers that came as a key speakers and came to participate in the events as well. So we had Way Home Scotland, that is a national coalition to end youth homelessness in Scotland. They are at that time producing a Scottish report. They were commissioned by Scottish government to produce a report on preventive pathways for youth homelessness. So the time was good because they were invited to be part of this. We were discussing issues regarding to prevention as well. So they wrote the preface of the final report. The final report is here, just you to see. So Way Home Scotland wrote the preface of this report, and the key message were used to feed this Scottish report on youth homelessness prevention pathways. So another central element to myself is we need to involve policymakers since early stages of our research projects, programs, as soon as possible, because as happened, they were in the time producing a policy, and because they liked the approach, the program, the outcomes, this was used. So I was invited to be a member of this coalition, and I was one of the members signing the report representing the University of Dundee. So these are examples that can happen when we plan and when we work together with policymakers. I think this is the way to really see practical implementations of our work.
Thank you so much. We're about 5 to 2 now, so I think that just leaves me to say thank you so much to you and to Professor Vieira for presenting today. Next week on Grand Rounds, we continue our global citizenship theme, and we have the topic then will be sustainable healthcare, and that will be presented by my colleague Tim Smith, who's another anaesthetist. Will be introducing Dr. Rosie Spooner and Hannah Farker to talk about that. If you're interested in the global citizenship theme, then please come and join us at Global Citizens Tayside on social media. We have a Facebook and a Twitter page that you can follow. And thanks again for joining, and we'll see you all next week.
Thank you.
Thank you very much.